It was a packed house for the 2025 Brain Health Forum, which took place at the Carter Center. The forum is a biannual event hosted by the Goizueta Alzheimer's Disease Research Center to raise awareness for age-related dementia.
We're assembling the tools and the processes and really the strategy to be able to implement, for the first time we hope, a successful model where we can identify people at risk for Alzheimer's, other forms of dementia, and other major brain health diseases decades beforehand.
We educate you about what the disorder is, what it is not. More importantly, what you should be doing to make sure that you are getting the proper preventive health exams and screening exams to look for things like Alzheimer's and related dementia.
I'm African American. It affects our communities much more significantly in terms of numbers, in terms of the impact on our communities, in terms of all the time, energy, and money that's used as caretakers. Sometimes we are care providers for our seniors and our children and our grandchildren.
Patients can have lots of psychiatric.
Lesser-known forms of dementia, like frontotemporal dementia, were also on the docket.
People just don't know it exists. And that's a big issue, is the awareness that's needed for frontotemporal dementia to make sure that people know to look for it.
But let's say that you're diagnosed with migraine.
Scientists are also exploring possible links to other conditions like migraines and type 2 diabetes.
And it actually showed that migraine increases the risk of dementia by about 30%. And that risk is specifically higher in patients who have migraine with aura. It doesn't mean that migraine causes dementia, but it is a relationship that's worth exploring.
We know now that diabetes is a risk factor for developing cognitive impairment, Alzheimer's, and other forms of dementia.
You don't want to get diabetes. You don't want to get hypertension. So we want to eat properly. We want to exercise regularly. Exercise 150 minutes a week at least or more. We want to get enough sleep.
We give you a diagnosis of dementia.
As a family physician and primary care provider, I always tell families that when things don't look normal and things are going awry, pay closer attention.
We now expect that 40 to 45% of Alzheimer's disease and related dementias might be preventable if people modified their lifestyle decades in advance.